each location that will receive or administer vaccine. However, you will only need to sign the provider agreement once. We also want to encourage you to start the enrollment process even if you don't see yourself vaccinating in phase 1, as it's currently taking about 2 weeks to process applications. You can enroll and find out more information at www.covidvaccinewa.org. Providers who fully enroll by December 6th will be eligible to receive vaccine doses in the first shipment. If you have questions about the process, please contact us. And vaccine prioritization. We're working on finalizing our initial vaccine allocation and prioritization framework. This framework includes feedback from the communities, partners, sectors, and industries that are heavily impacted by COVID-19. We will also use guidance from the Federal Advisory Committee on Immunization Practices, also known as ACIP. ACIP began voting on their allocation recommendations in a special session yesterday and will continue discussions at their full meeting next week. What we know for sure right now is that the first phase of that vaccination, called 1A, will focus on workers in healthcare settings that serve patients who either have confirmed or suspected COVID-19, along with staff and residents of long-term care facilities. We'll know more about who will be vaccinated in later phases after we learn more about the future decisions of the ACIP. We will review those recommendations and see how they align with our current planning and community input that we received in Washington. This is one of several recommendations we're considering, like I said, in our prioritization planning. We are also working on tools to make it easier to figure out which phase you're in. So when you personally will be eligible to receive vaccine. This is a very exciting time for us, but there's still a lot of learning to be done. For example, further research is needed to understand how long this vaccine will protect us. Getting vaccine to the people of Washington is a large and coordinated effort, and the timeline for all eligible people to receive vaccine will take many months. And so that's it for my remarks today. Thanks, Corey.
Thank you, Michelle. Next, we'll go to Dr. Kathy Lofy. Correction. We'll be going to Secretary of Health, John Wiesman.
Great. Thanks so much, Corey, and thanks everybody for joining us once again. In addition to the encouraging updates that Michelle just shared on vaccines, which obviously we're very excited about, we had another major announcement earlier this week on Monday. As many of you know, Governor Inslee announced the launch of WA Notify, our state's new exposure notification tool. WA Notify will complement the work of local health jurisdictions in this state that we're already doing to slow the spread of COVID-19, including case investigations and contact tracing, and gives people another tool that they can empower themselves. This new feature enables your smartphones to notify you if you've been near someone who was later diagnosed with COVID-19, all without collecting or sharing any of your personal information. Again, this is all voluntary. People opt into this and can also opt out of it once they do opt into it. As of this morning, we are thrilled to say that more than 875,000, that's 750,000 Washingtonian residents, have already enabled this feature, about 11% of the state's population. And I'm really excited to see those numbers. And I encourage everyone who has a smartphone and is not yet enabled WA Notify to do so. You can find the instructions online at wanotify.org. If you have enabled WA Notify and you get a notification that you may have been exposed, really get tested as soon as possible, follow the instructions, and for everyone who tests positive, make sure to answer the call or call right back when public health reaches out to you. This launch is especially welcome right now. We need every tool we have to help get control of the spread of COVID-19 in our state. It will take a little while longer to see in the data whether the new restrictions that began in mid-November are working, but we remain deeply concerned about our situation. Dr. Lofy is going to share more information on our current trends in her update, but we continue to see high daily case counts and alarming increases in hospitalizations. We also expect that there may be an uptick in new cases following Thanksgiving gatherings that may have occurred. We're all making difficult sacrifices this year. I know that. We're tired. And I'm so grateful, though, for those of you who are choosing to celebrate the holidays or other events virtually and only with members in your household. We really are at a tipping point, and each action we take could be the difference between unknowingly passing on COVID-19 and stopping the virus in its tracks. We must hold steady and continue to make the choices which we know will work to slow the transmission. Every day we can choose to protect the elderly and most vulnerable, as well as the essential workers who are facing risks every time they go to work, whether those be our healthcare workers, our daycare providers, our people who are providing services in our grocery stores, our hardware stores, and so on. We make a difference for the healthcare workers who have been doing this exhausting and emotionally draining work for 10 months. We must all stay committed to gathering remotely, wearing masks around people who don't live with us, washing our hands more, and staying home if we aren't feeling well. With that, I'll turn it back to you, Corey.
Thank you, John. Next, we'll go to Dr. Kathy Lofy.
Good afternoon, everyone. I am going to show you a few slides. So just give me a moment to pull them up. Great, you should all be able to see my slides. Well, good afternoon. I'm going to run through some epidemiologic slides and also share some data around hospital bed occupancy. So this first graph shows that COVID-19 cases are continuing to increase. One point that I wanted to make during this presentation is that our epidemiologic surveillance data is always difficult to interpret around the holiday weeks because people's healthcare seeking behavior often changes. So it can be particularly hard to interpret case counts and percent positivity because we know that there were a number of people before Thanksgiving who wanted to get tested just to see, if they were infected but didn't have any symptoms. We also know that some people with mild illness may not be likely to go and get tested during a long weekend. So it can be very difficult to interpret the data around the holidays. Over the past couple days, it does seem like the number of cases that have been reported every day has remained kind of closer to around 2,000. But again, we're not really sure if that is a positive sign or if that's just a change in testing behavior over the holiday week last week. And it's really difficult to interpret, the data in this gray shaded area, which is incomplete data. So since we are not currently showing test positivity on our dashboard, I did want to show you test positivity data that is collected by our federal government. So most of the labs here in Washington that are doing testing report their data to the federal government, and this is what the data shows. You can see in the orange line that over the past week, it does look like test positivity had flattened out a little bit during the holiday week, but I just do want to emphasize that we really just don't know, what that means, given the week is just unusual in many ways. So what's really concerning to me is that we still continue to see a really sharp increase in the number of people who are being hospitalized for COVID-19 every day. You can see that this graph that graphs the number of patients admitted for COVID-19 by hospital admission date is continues to sort of increase in a very steep way. Also concerning is that we are now seeing an increase in COVID-19 deaths. If you look down in early September, you can see that, around 5 deaths were being reported per day, and this has kind of steadily climbed over time to somewhere around an average of 12 deaths being reported per day. So unfortunately, we are starting to see more deaths being reported in this third wave of illness that we're experiencing. So these next graphs come from our risk assessment dashboard, and these are very concerning to me. So this is the graph that shows COVID-19 hospital bed occupancy in the state as a whole. And you can see that the number of confirmed and suspected COVID-19 patients in our hospitals has increased dramatically since the beginning of November and continues to increase. On our dashboard, you can actually break down this statewide data into regions. So this slide shows COVID-19 hospital bed occupancy in 4 different regions of the state. You can see in King County, the number of confirmed and suspected COVID-19 patients continues to sort of rapidly increase. In Pierce County, Grays Harbor, Lewis, and Thurston, also seeing a very sustained increase. Over on the east side in Spokane, it does look like maybe over the past few days, the number of patients in the hospital has been a little bit more stable. In Southwest Washington, seeing a pretty sustained increase as well. And this is very concerning because our hospitals, have limited capacity to take care of patients. And what we're hearing from the hospitals is that many of our hospitals are canceling a lot of their non-urgent procedures now to make space and to make sure they have enough staff to take care of the increasing number of COVID patients that are coming into their hospitals. And then this last graph I wanted to show you are the number of confirmed and suspected COVID-19 patients that are in ICU beds in our hospital. You can also see that there's been a very rapid increase and a sustained increase in the number of patients hospitalized in our ICUs. So in summary, I'll just reiterate that the case counts and the percent positivity are always difficult to interpret during holiday weeks. So unfortunately, I think we need to wait for another week of data to really better understand what's happening with our case counts and our percent positivity. What we do know for sure is that our COVID-19 hospitalizations are rapidly increasing throughout the state, and that our deaths are increasing as well. And the number of confirmed and suspected COVID-19 patients in our hospitals and in our ICUs are increasing rapidly. The number of COVID patients in our ICUs has doubled during the past 3 weeks. And if we do not reverse this trend, hospitals will need to postpone more of these non-urgent surgeries, and we'll have a reduced ability to care for patients both with and without COVID-19 in our communities. So that is my update on the epidemiology and the status of where we are in the pandemic. I did want to just give a few other quick updates. First of all, I wanted to give you an update on some of the recent data issues that we have reported to you all. First of all, back on November 21st, we did have to stop processing some of our negative COVID lab results. Due to our system not being able to process all the positive and the negative results that were coming in. I just wanted to report that we have been able to speed up the processing of our positive and negative lab results, and we do hope to resume reporting negative lab results on our dashboards on Friday. Another issue I wanted to give you an update on is that we have been having some issues with deduplicating some of our positive lab results because labs often will send us 4 positive results from the same patient on the same day, as there are small updates in the positive lab test that's being reported. We are working with our vendor of the system that does the deduplication. They are working on the code, the proprietary code in their system to speed up the ability to deduplicate. So just wanted to make sure that people understood that issue and knew that we are actively working on it. And then lastly, I just wanted to speak a little bit about the quarantine period and some of the changes that CDC announced this morning. So today, as most of you know, CDC announced some new options to reduce quarantine for people who have been exposed to COVID-19 cases. And I just want people to know that we here in Washington are planning to adopt the new guidance that CDC released today around the quarantine period. It will take us a day or two to update all of the documents on our website that have this. There are about 15 different documents that talk about the quarantine period on our website, and we're in the process of getting those updated. And just to reiterate from this morning, the CDC and the Department of Health do continue to recommend a 14-day quarantine period. However, the quarantine period can end after 10 days if the patient or if the contact does not have any symptoms. However, that individual needs to continue to monitor for symptoms for the full 14-day period. And then the other option is that to end the quarantine period around 7 days if the person who has been exposed remains asymptomatic and tests negative with about 48 hours before that quarantine period, within 48 hours of when the quarantine period ends. But again, that individual does need to continue to monitor for symptoms for 14 days, for the full 14-day period, and make sure that they isolate should they develop any symptoms. CDC has updated their website with this information. I encourage you to go look at it, and we will be adopting these options here in Washington as well. So with that, Corey, I think I'll go ahead and turn it back over to you.
Thank you, Dr. Lofy. Our final remarks come from Dr. Kiramasa.
Good afternoon, everyone. So from a behavioral health perspective, as I mentioned last week, we are experiencing the disillusionment phase of this recovery cycle, and we're forecasting a bit of a longer extension of that phase than what might be typical for other disasters. So this is the time where many of us, if not most people, are feeling really burnt out, exhausted, really overwhelmed, especially as we navigate the stress associated with the higher infection rates that we're seeing and the hospitalizations. The risk of suicide and depression and hopelessness, as well as substance use, sort of historically are at their highest during this phase of any disaster. And that's it's actually pretty consistent with what we're seeing clinically and the things that my colleagues and I are hearing from our patients right now. Between symptoms of depression and anxiety together, we're seeing already numbers close to around the 3 million mark in Washington state for people who are experiencing those concerns. So many of those symptoms are related to the social isolation, the changes in lifestyle and employment for some, fears around the unknown about what's happening right now and what's still coming around the corner. And then the stress and pressure of balancing all of the things that lots of us are juggling with childcare and work and school and that sort of thing. So in Washington, the other thing, maybe today is a bit of an exception with the blue sky, but we're also balancing the seasonal affective stuff. So the weather, when it gets dark and rainy and gray for such a long extended period of time, that really affects people's mental health and a sense of depression as well. So seasonal affective conditions can also really play a role in how people are doing right now. These are real challenges for everybody, and particularly for healthcare workers. When you think about what they're experiencing right now too, they're just as taxed emotionally as the rest of us, physically and mentally, and even more right now with the things that they're risking, trying to help, keep everybody safe and get everybody healthy as quickly as possible. So something to consider for those folks as well. So things to do from a behavioral health perspective. Try to get rest and sleep on a regular cycle. Trying to practice like sort of a routine for yourself with sleep is a really strong recommendation right now. Exhaustion makes everything worse. It makes us have less of an ability to regulate our emotions and to sort of handle the day-to-day things that come up. All of those symptoms are going to get a little bit better if you can get some more sleep. Find some very small things that you can do every day to give yourself a sense of peace or some space, even if it's from your own family, just to step outside for a minute and take a breath, get some fresh air. Remember that resilience is developed through purpose, connection, flexibility, adaptability, and hope. Another strategy right now that is particularly sort of appropriate at this time of year is this idea of active gratitude. That's something that we can practice by paying a little bit more attention to the things that are going well in our lives, because there are those things. It's easy to ignore right now. Our brain doesn't want to pay attention to those things, but attending to them is going to help us feel better. If that's hard to do, finding ways to express it outwardly towards other people is another good thing to do. It's kind of a 2-for-1. So you can support somebody else by showing gratitude to them, and you also lift yourself up by doing that a little bit as well. Last thing in terms of stuff we can do here to feel better about this situation in a behavioral health lens is to practice some patience. So patience is one of those core values that's really in short supply when we're totally exhausted and we're tired of this thing dragging on, but it's needed more than ever. So being patient with our kids at home, with colleagues, with strangers that we come into contact with, just taking that moment, and on a much larger scale, patience with the vaccine. We are all really, really anxious to get through this and back to a way of living and kind of being and existing that's familiar and comforting. But as you've heard from my colleagues, it's coming, it's on its way, and it will take time to be made available to all of us. So please have patience for that process. There are many great people working really hard on getting it out there, and we want to make sure that it's done correctly and efficiently. So patience is going to be important in the next several months. Bottom line is sort of start by acknowledging, what is really common right now, these symptoms of depression and anxiety that are really, really common for a lot of folks. And for other ideas about what to do, you can check out our website. So that's coronavirus.wa.gov/wellbeing, and ask for help. Contact the Washington Listens line. If you're concerned about symptoms of depression and anxiety, talk to your healthcare provider, and work on prioritizing sleep. Right? Keep those ingredients of resilience in mind and active gratitude and patience over the next few weeks. So small efforts in those really significant areas are going to have big payoffs from a behavioral health perspective in the next few weeks. That's it for me today. Thanks, Corey.
Thank you, Dr. Massa. With that completes the remarks portion of today's briefing, and we'll move into our media Q&A. We have a number of media set to ask questions today, so if we're unable to get to you in time by the top of the hour, we will follow up by email. Feel free to reach out. And with that, given the number of folks we have asking questions, we'll need to limit follow-ups. So please email us your follow-ups at doh-pio@doh.wa.gov if you have any. With that, we'll open questions with Rachel LaCourte from the Associated Press. Rachel, you're unmuted.
Okay, thank you. Michelle, has the state participated in any end-to-end training exercises with the packaging that will be used to distribute the Pfizer vaccine? And if so, how has that gone? Have there been any potential problems identified?
Yeah, great. Hi, Rachel. Thanks for that question. We are participating in one of those exercises this week, and that is where there was a practice shipment of the packaging, the packaging solution that Pfizer has, and they were shipping it out to one of our local health departments in the state. I don't think we have information to report back, but we can follow up at the moment, but we can, I'll make sure we have that answer, Rachel, and can follow up with you if we have information on that yet. It may be later this week still.
Our next question comes from Ariel Dreyer with the Spokesman Review.
Great, thank you. My question is also for Michelle. Michelle, has the state already pre-staged some of the Pfizer vaccine at larger facilities or hospitals in the state, or are there plans in the works to do that?
Yeah, we're working on those pre-staging sites right now, or have been for a while. That information is due to the federal government at the end of the week. There was around 20 sites that we're talking with, and those are sites that already have ultra cold storage. They would get a portion of our first allocation of vaccine, that's 62,000 doses, and we should have that finalized list available next week.
Our next question comes from Anna Boyko-Wayrock with KOW.
Hi there, another question for Michelle. so popular. So with yesterday's recommendations from the Advisory Committee on Immunization Practices, the inclusion of long-term care facility residents is different than what the National Academies recommended, and so putting them in, which put them in 1B rather than 1A. For Washington State, which phase is Washington going to put long-term care facility residents in, and why?
Yeah, we want to include them in phase 1A. It may be a little bit staged because we will focus on healthcare workers first, and then we'll be turning on the federal program that they have with Walgreens and CVS to help support vaccination in long-term care facilities. And that just takes a couple of weeks to get up and running, but we will include long-term care staff and residents in phase 1A.
Our next question comes from Jessamine McIntyre with Q13.
Hi, Michelle. Sorry to keep bugging you. You're our woman of the hour, I guess. What would you say the biggest hurdle the state will have to overcome, to get the public or to get the general public vaccinated? And also, when or how will those in the general public know when it's their turn to receive it?
Yeah, great questions. And I understand why everybody is interested. We are really all holding out hope for the vaccine, especially with what Dr. Lofy and Secretary Wiesman were explaining with the reality of the situation of where disease at. It's exciting to know that we've got some vaccines that look like they're going to work very well kind of right around the corner. So totally understand the questions. As far as the hurdles, there are many. This is a huge program. We, quite frankly, are trying to vaccinate every person in the world. Is the campaign of this is the goal over time, really, for our state, focusing on making sure vaccine is available to every person who chooses to be vaccinated. And I think one of the pieces about that is one of the challenges is just making sure everybody has the right information. We know people have questions and concerns about vaccine, and we want to make sure that as we understand all the clinical trial data and the committees that over the next few weeks we're independently reviewing that data, kind of learning what we know about vaccines, how well they work, what are some of the side effects, what should people expect, because we really want them to feel confident in making a decision to be vaccinated. And the first people out of the gates are healthcare providers, and they're going to want to be looking at all that data and understanding it. And then we need them to consider making a choice to be vaccinated themselves, and that will help them be comfortable making a decision to vaccinate, to make a decision to recommend vaccination to the patients they serve.
Next, we have Glenn Farley with King TV.
Hi, Michelle. You're going to get tired of us, but I want to talk about milestones and deadlines. So the Friday deadline this week includes getting the plan in place for these distribution sites. Is there anything else that is part of this deadline? And this month, are there any other deadlines coming up that you need to meet?
Yeah, so this first deadline at the end of this week is for us to tell the federal government, to tell CDC about these pre-positioning sites. So who is ready to go to have vaccine that we could move right after FDA licensure, so have it sent, or FDA authorization to have it sent into the state to be ready to go. And so, like I said, we're working with about 20 sites to get all the logistics out to already have vaccine ultra cold storage capacity, because this is the Pfizer vaccine, is the first vaccine. That will be part of the how we'll use the first 62,000 doses available to the state. But then also over next week, we're going to be looking at the providers who have also registered already and completed the process to understand whether the populations they're serving, how many doses that I think they could use, so that pretty soon, it's almost within a day or two probably of when those pre-positioning sites will be getting vaccine. We'll be placing vaccine orders for other sites in our state as well to also get out that full 62,000 dose allocation.
Our next question comes from Tammy Matassa with Como.
Hey, thank you so much for your time. My question is for Dr. Fotinos about testing. Dr. Fotinos, this week, Dr. Deborah Birx with the White House Coronavirus Task Force said that if someone gathered with people outside their household on Thanksgiving, they should assume they're infected or exposed with COVID-19 and get tested 5 to 10 days later. Plus now the CDC is saying that if people do decide to travel, they should get tested 1 to 3 days before travel and 3 to 5 days after. I know a lot of different dates. My question for you is, do we agree with this guidance? And if so, does our state have the capacity to do all this type of testing? Thank you.
Sure. Thanks for the question. Every question I've been asked the last 10 months starts with, it depends. And I think part of it depends if people, were studious and quarantined themselves or whoever they were traveling with for 14 days without any contact with anyone, and the people that they went to see did that as well. That's one scenario. If people happen to meet outside in their backyard and practice social distancing and wear masks, then no, that wouldn't necessarily be an at-risk event. For people who, were inside with larger numbers of people than recommended, which is anybody outside of your household, should they get a test? It's probably not a bad idea, but it also depends on what the community spread is like, where they're living. As Dr. Lofy said, rates are going up everywhere across the state. So would that be something people could do? Yes, they could do that. In terms of testing before you leave, that's to sort of check at that point in time before you get on the road. Do you have enough virus or infection on that day that the test can pick up? It won't tell you what happens the next day or the day after that. The thinking of testing then 5 to 6 days after 7 you've been exposed to someone is it can take that long for the virus to reach levels if you have been infected to show up on the test. There are a number of home testing kits that you can go online, and at the Department of Health website under the testing there is a link to those. So if you don't want to go stand or have your car in a line for a long time, that is another way in which to order tests. Do we have enough capacity? There is capacity. We have heard that some labs, their turnaround time is slowing down just because of the demand. One of the other things is a lot of places now are testing that didn't used to, and they don't have in place electronic systems to send information from where that test is collected to the labs. And so a lot of the labs are having to enter in by typing, handwritten information into computers. So there are a number of things that are contributing to slower times, including the demand. But there is capacity, particularly if people, look to order the available home tests. And in terms of whether or not anybody who left their house for Thanksgiving and went somewhere else should be tested, again, I think it depends on how well they were following the guidance if they were going to be around other people.
Next, we'll go to Sarah Gensler with McClatchy.
So this one would be for Dr. Fotinos as well. A pilot program in a few school districts in Pierce County is looking at weekly testing as a way to potentially get students back into classrooms. I'm curious what you would have to say about the efficacy or potential efficacy of those programs. Do you think that's a strategy that could work, especially since they're using rapid tests, which, as I understand, may not be as accurate?
I think that, thank you again for the question. There are other states that are doing similar things. New York, for instance, has had a regular testing frequency of students in their schools. What we're starting to understand is that even if a test isn't perfect, and some of the rapid tests are very decent, are they as good or sensitive as the PCR tests? No. But if you repeat a test that has moderate sensitivity at an interval, an appropriate interval, then you're likely to catch infection early on and limit the spread within that setting that you're testing. What's the magic number? Is it 2 days, 3 days, a week in between? I think that part of the science isn't yet figured out, but people are getting, closer to understanding. So serial testing in a congregate setting, which would include schools, is a reasonable strategy, even if you're using the antigen test. That has to be accompanied by screening everybody, staff and student, before they come in, so that if anybody, does have symptoms on a day that they're not being screened, they can be directed to testing, as well as practicing all the appropriate environmental control measures that should be happening in schools anyway. The distance, the masks, the proper, sanitation and cleaning of desks and everything else.
Our next question comes from Keith Eldridge with Como.
Hi, we're going back to Michelle for this question. I'm checking to see, it sounded like on 1A that not every healthcare provider is involved in that. Is it possible that you're going to be only those involved that are coming in close contact with COVID? How many of those are there? How many of the long-term health people, residents are involved? So what are the numbers of that? And are the healthcare providers not directly involved in COVID going to be pushed to essential workers in 1B?
Yeah, thanks for that question. Our intent in the beginning is to definitely focus on those healthcare workers or workers in a healthcare setting that are either serving people who have COVID or caring for people who have COVID or interacting with suspect COVID cases. So that is really, they are the most at risk group and really the one that's helping support our healthcare infrastructure at the moment. So that's our first focus. Other healthcare providers will likely be later on in our phases with other essential workers, and really want to make sure we're getting to some of those other high-risk groups, which includes the other group in 1A, long-term care facilities, as staff and residents. As far as the numbers, we do know in that 1A category of the healthcare workers that are most at risk, we believe that's about 300,000 people in our state. We can follow up, Keith. I don't remember the numbers at the top of my head for the long-term care staff and residents, but we do have that information. I will say that estimating these numbers is an art. It's not an exact science, so we're looking through lots of different sources. We're talking to the hospital associations and the employers to kind of continue to make sure we have the most refined number we do, so we can really understand how does that number match with what we know about our vaccine supply, which will help us target long-term when we can move between phases.
Our next question comes from Evan Bush with the Seattle Times.
Hi, this is a question for Dr. Lofy. Dr. Lofy, I was hoping that you could make some comparisons with hospitalizations at this moment in the pandemic as compared to March and April and the spring surge that sent so many folks into the hospital. Thank you.
Yeah, so currently, when you look at the number, I could pull my slide back up. So if you look at the number of people being hospitalized each day, we have now exceeded the number of patients being hospitalized each day than we actually saw back in the spring. And we have also exceeded the number of patients in the hospital on any given day. We did not collect bed occupancy data in the same way in the spring, so that data is a little bit harder to compare. But from the earliest data we have from the spring, it does look like pretty much every region has now has more patients in the hospital than they did in the spring. And it's variable depending on how big the spring wave was throughout the state. So for regions of the state that didn't have much of a spring wave, the number of patients in the hospital now is much, much greater than it was in the spring. King County looks like just surpassed the total number of hospital patients that they had in the hospital in the spring. from the data that we have available. And as I said, right at the end of March, we were not collecting the data in the same way.
Kathy, it's John. If I remember right, in the summer surge, at any given time, we had about 400 patients or so maybe in the hospital, and now we're almost 1,000 with COVID, if I remember about right.
That is correct. I'm pulling up the graph, and in August, early August, we had about 500 patients, confirmed or suspected COVID-19 patients in the hospital, and now we have 1,077.
This is our concern, folks. I mean, these are really large numbers, and at the beginning of November, we were probably in that 400, 500 range. And so just in the last, month, we've gone dramatically up. I see Kathy's looking to confirm my my memory.
Yeah, we just more recently started collecting the ICU data, so we do not have number of patients in the ICU from back in the spring.
Our next question comes from Jeff Quigiola with Como.
So this is kind of more of a political question for anyone who really wants to take it. I'm just looking for some reaction to the move by some on the Pierce County Council to dissolve the Tacoma Pierce County Health Department and replace it with one that reports directly to political leadership rather than the Board of Health. Anyone who wants to take that.
So this is John Wiesman. I can take that. So first of all, certainly these are local decisions. That is the way the law is structured, is for counties to be able to determine who and how they organize their local health departments. I think anytime a group wants to make this move, it has to be carefully considered and examined for what the both advantages are, what the disadvantages are, maybe the unintended consequences. Health departments are something that really, I think, serve the entire community, and these kind of decisions deserve full community input into such a large potential change. So I certainly encourage any local leaders to see to it that that happens. These health departments serve everyone in every community. Local boards of health are formed by state law. There are required local boards of health, and they certainly range from county departments to health districts and to city-county health departments like Tacoma Pierce County Health Department. I think that one has to look at funding issues, what happens when you switch from one form of government to another in terms of the funding resources, in terms of input into policy and getting consensus in larger communities around what policy should be. And all of those things have to be examined. It's not something that should be rushed, in my opinion. They have major consequences. But I also do believe that communities need to examine their governance structures and certainly consider what the law says about that. So I know that's a recent development in Pierce County. And again, I just encourage careful thought and consideration to the potential benefits as well as unintended consequences.
Our next question comes from Patrick Quinn with Como.
Hey, this question's maybe for Dr. Lofy. It's about the changing in quarantine guidelines, and it sounds like the state will adjust just like the CDC recommended. One of the reasonings they gave is that with a shortened potential quarantine, maybe there'll be more adherence. Are you hopeful that Washingtonians will follow suit in that same hope? that maybe if there's a shorter stay, you can get a negative test, more people will do it. And then I guess my second question is, CDC also suggested not traveling for the holidays. They went ahead and made that guidance announcement today. Is the state making the same recommendation with regards to Christmas?
Yeah, thanks for those questions. So I agree with CDC's reasoning. I do believe that people, probably will be more compliant. We know that 14 days is a really long time for people to stay at home and away from everyone else. So, we certainly do hope that, people, are more compliant with these options that are a little bit shorter. I do think it's really important for people to remember that, by taking these options, there is some small risk that they still can spread the infection, after that shortened quarantine period. And so it is really important that people continue to watch for symptoms, for the full 14 days and make sure that they're always wearing, their facial coverings when they're around other people. But yes, I hope that there will be improved compliance. In terms of traveling over Christmas, I do not think it is a good idea to travel. I don't think it is a good idea for people to travel over Christmas. We know that this disease is increasing and there is significant transmission throughout the entire country. It's really, this time, we need to get through the holidays. And I think that it's really best if people, again, plan to stay home, with their immediate families.
Our next question comes from Angelica Levito with Bloomberg.
Thank you. Appreciate you taking my question. Michelle, this one's for you. In terms of these end-to-end exercises, do you know if the state has received its practice ancillary kit supply from McKesson, or whether there have been any issues in getting that to the state?
Well, thanks for that question. And I actually was texting with staff to go back to Rachel LaCourte's question as well on the same one. So I can say that that process is happening this week. We placed for the end-to-end testing, we placed our order on for vaccine on Friday, and the shipping is happening today. So the same thing is happening with the shipping of those ancillary kit materials that happen in conjunction with the shipping of vaccine. So we should have more to report out today, but just that is in progress this week as we speak.
Our next question comes from Hannah Weinberger with Crosscut.
Hi, thank you so much. This question is for Dr. Wiesman. It's exciting to hear how many people are already downloading the WA Notify app, especially given that you're rapidly approaching that 15% population download statistic that correlates with a non-negligible decrease in infections and deaths. I'm wondering, though, in past weeks, even the people behind that study have noted that they did not factor in human compliance with the app, the rate at which people actually upload their PIN to produce an exposure notification. And I'm wondering what Washington is doing to explore how they can increase the rate at which people actually follow through with uploading a PIN. What kind of interventions there are for that.
Right. Well, thanks for that. And yes, without experience, this is new technology. We have to rely on modeling studies, at least at the outset, which we are doing. I think the really important piece here is that when somebody tests positive and public health workers reach out to call them, that number one, we need people to answer the phone, call back if we leave a message, so we can have that conversation with them. Both about their situation, understand how long they may have been infectious, and make sure they have the advice to isolate themselves and the supports to do that. and then have that conversation about, are you using the WA Notify app? And if you are, make sure we're walking through with them how to enter their verification code, and talk to them about any concerns they might have about that, and make sure they understand that when they do that, other folks who they have been near in that period of time that they might have been infectious will get, an alert on their phone that does not tie them to the individual who's tested positive or to the location where they may have been exposed, and so that they really understand this is anonymous, and there is, complete privacy here. And that they're also in control of that, and encouraging them to make sure that if they have that application or that a setting activated on their phone, that this is helpful to everyone. This allows us to move faster in terms of notifying somebody that they might be at risk, and to people who we wouldn't necessarily know, we couldn't identify because we don't know who they are, that we might have been around. So it's that, I think, time and rapport with the case and contact investigator that is an important piece, as well as just the marketing about WA Notify, and that as people sign up, they basically know how it works.
Thank you so much.
All right. Our final question today comes from Allison Grande with Cairo, and I'll be reading it off on her behalf due to some tech difficulties. So, can you please let me know the latest information on where paramedics and firefighters rank in the Washington vaccination distribution plan? One of my coworkers was mentioning that they appear to be listed in 2 different tiers. I believe this question is for Michelle.
Yeah, thanks for that question. So first responders who have the highest risk, which includes our paramedics, our EMT type of staff, are included in phase 1A with those types of workers in healthcare settings that are most at risk. Other types of first responders will come in later phases. And like I shared earlier, we're really working through some of those details of what the later phases will look like, because we just don't have all the pieces of information about yet to say exactly what order will people be in for the rest of the vaccination. But we're working on that and waiting to see where the Advisory Committee on Immunization Practices goes as they continue to make decisions on what their recommendations are.
Thank you. With that, that completes the media queue for today's briefing. I'd like to thank our panelists for making time to join us, and for all of you for tuning in. And also a special thanks to TVW for hosting a live stream of today's briefing. This briefing and past briefings, recordings of them, can be found at tvw.org, as well as the Department of Health YouTube account. This concludes today's briefing.